Hello, Jenny from Lemon Balm Massage and Wellness. Today I wanted to teach you techniques to help with tech neck. Tech neck is a new name for an old set of problems or symptoms that have been going on for a long time. Tech neck is strain in the cervical spine, so in your neck, from repetitive injury or use. And so when we spend time looking at our cell phones or our tablets or our laptops on that, when you sit it on your lap instead of up on a desk, those all can contribute to repetitive strain of your neck. Symptoms of tech neck are ache in your neck, headache, ache in the upper back, ache in the shoulders. You can even get numb tinglies down into your hands or lose curvature in your spine. And I am not here to help you diagnose that. You need to talk to your physician, your physical therapist, or your chiropractor to help get that diagnosed. All I'm here to do is help you with the soft tissues and what you can do for yourself when you are experiencing headache, neck ache or strain. Any of those symptoms that I just mentioned, you can always try a little at home. If you have an injury, if you are currently under the care of a doctor for a whiplash injury or anything of that nature, check with your physician first. Always check with your physician before you start any program of exercise or massage or self-care, and make sure that it's a good fit for you. If you've had fused vertebra, for instance, you may need something very specific. And I would be happy to work with you on that if that's something you're interested in one-on-one. But you have a special need. So be aware of that going into this, that if you have a special need, this may not be the right fit and you should consult with your physician first. So that being said, what we're going to start with is an assessment. And what I want you to do is you're going to do a range of motion with your neck. We're going to do several ranges of motion and check. We're looking for tension. We're looking for ache or little catchy spots. And we're going to rate that when we're done on a scale of 0 to 10. Right now, it's still kind of early afternoon for me and I'm feeling pretty good. So we'll see what's going on with my neck. Later in the day, I might be more fatigued, or you might be more fatigued after a full work day. Or a day spent in the yard, or who knows what. But so we're going to start with really simple. I want you to just look up, raising your chin up to the sky. Stay within a range that is comfortable for you. If it feels like a good stretch, that's about right. Same thing. We're going to come down now. Drop your chin to your chest. Hold that for a few seconds. And remember, we're assessing. We're getting a feel. Now we're going to look over, pick one side, left or right, doesn't matter. And look over your shoulder gently. We're being gentle, right? We're just doing an assessment. This isn't like a strain at all, stretch at all. And then we're going to look to the other side. And you're just getting a feel in your neck. Does one side turn farther than the other? I can tell. This side is a little more stuck. I can't quite get my head to go as far as I can on the other side. So, and we're going to do just one circle one way, and then we're going to circle our head around the other way. So all we're going to do is I've chosen to start from my right shoulder and go around to my left. So if you're copying me, it would have been from your left shoulder over to your right. And now we're going to go the opposite direction. And I am just feeling for any catches, any tight spots, anything that might be contributing to my neck ache or headache or strain. So now that we've assessed, I want you to, on a scale of 0 to 10, say, today I've got this stuck spot. For me, I do. I can feel this in the back of my neck, this stuck spot. And I would say it's like a 2 or a 3. It's not bad. It's noticeable. So what we're going to do first is a pin and stretch technique. I am going to hold the tissue of where my neck attaches. So I've got these muscles. I've got several muscles that come down and attach. But there's the points on my collarbone are right here. I'm coming just below those on my, just below those, right on my very first ribs right there. I'm holding on either side of my breastbone, and I'm going to hold those and stretch up. And you can see probably my skin moving, but that's a really, really good one. So when they talk about tech neck, you're talking about a repeated strain where, your vertebrae are being asked to bend and to bend and to bend. So they're in extension continually on the back side. And on the front, you're doing repetitive contraction, contraction, contraction. So we're trying to massage and stretching lengthens tissue. And we're trying to lengthen tissue that has been repeatedly contracted. So we're going to move from there. We're just going to move down an inch or less, like a finger width, right? I'm just going to go to the next, and I'm going to pin it again, and I'm going to stretch up. And then I'm going to come back down, and we're going to go down again, just one finger width or an inch, however you want to measure it. And each time I moved down, I felt a little bit less, but you can still feel some. I still feel right there in the center. When I tip my head back, I can feel the pull on the tissue right here. So that's the pin and stretch. We're pinning the tissue and stretching. Okay. The next technique is actually going to be massaging the muscles in the front of the neck. We want to be very careful. You have really important blood vessels that supply blood to your brain and things. So we're not going to push in at all. What I'm going to do is I'm going to show you. You can kind of see on this side. I have some red marks because I've been doing this a couple times already, but you can see right there, I've got a muscle, the shadows kind of, and I've chosen to reach across. You can totally do the same side. Just when I do that, you can't see anything. So I'm going to bring my head down and over to the side I'm going to work on so that I get slack in that muscle, if you will. I mean, it's always working, and I'm just going to, and I'm going to tip my head up so you can see. But all I'm going to do is you can use 2 fingers or 3 fingers, but all I'm doing is gently getting a hold of that muscle and rolling it between my fingers. So it's kind of like this. I'm just grabbing and rolling it through while I gently pull. I am not pushing my fingers into my neck. I am just finding it and pulling out. Okay, and then the other side. Same thing. If you're having a hard time finding that muscle, if you roll your finger over, you can generally feel, you can see right there, especially if you tighten it up, right? So again, bring your head forward and to the side to help give you a little give. And we're just going to pull gently. And if you want to go through this, if that felt really good and you want to go through this a couple more times, you can, but we're going to keep moving forward. The next technique, so that muscle I just did starts right here behind your ears and comes right down here and attaches at your clavicular joints, at your clavicles. The next muscles, and that's your sternocleidomastoid, right? Because it comes down and attaches at your sternum and your clavicle joints. Sorry. The next muscle I want to talk to you is actually more like a sheet of muscle and a lot of fascia, and it's your platysma. It starts at your chin and goes all the way down your neck and ends at your collarbones. And it is part of what goes on in the motion of your neck, and it can get stuck just like other muscles and fascia tissues can. So we're going to, for purposes today, you want to stay on the front half of your neck, and we're going to split that front half into thirds, right? I've got this side, front, center, front, okay? And we'll start with one side. And all I'm going to do is I'm going to take that tissue, and you can do 3 fingers or 2 fingers or 1 finger, whatever is comfortable for you. I'm going to actually do 3. And again, I'm not pushing into my neck. I am just pulling and rolling that tissue between my fingers. And so that platysma is very close to being right under your skin. So you don't have to go digging around for it. It's right there. So we've done that a couple of times down that side. Now we're going to come down the center, and no worries about skin under the chin. I've totally got some. This isn't going to make it worse. So I'm starting right under my chin, and I'm doing a little bit of that gentle pull. And you can probably tell it's a little more resistant than the side was. But this is exactly opposing your spine, right? So it's going to have a little more going on versus the sides, usually unless you've had an injury or something else special is going on. And then you can see I can't get a very good grip on this skin by my neck. What I can do is I can gently kind of pull, you see how I'm pulling my thumb across without pushing in. I'm putting my fingers right here and gently pulling across. So if that works better for you, like I was having a hard time right here above my clavicles, getting a grip, or my collarbone, getting a grip. See, and you can already see it's gotten easier just with that little bit of work. Okay, and then I'm going to switch hands and do that last third, that side third that we haven't done yet. And you'll be able to feel more resistance in different spots. It's just your body telling you a story about what's going on. I can feel that right there. But there we go. So we've done that a few times. So now we've done a pin and stretch. We've worked through our SCM, our sternocleidomastoid, which was that big one. And we've worked through our platysma, which is like a sheet that runs from your chin to your collarbones. Now we're going to work on the pec right under your collarbones. So you're going to find your breastbone, right? And you're going to come just off to the side of that and just below your collarbone. And we're going to do small circles all the way out, staying under your, just under your collarbone, all the way out to your shoulder. Sorry, that wasn't very easy to see. And then you can do that like 2-3 more times. I'm just going to do it one more time. And then we're going to switch sides. Same thing. I'm going to find my breastbone. I'm going to come right under my clavicle, and I am going to make small circles. And pressure-wise, you should do a pressure that feels good. So I recommend starting with a pressure level of 5 or less and seeing if you feel better with a little bit more. You can do a little bit more. And again, we're just doing the small circles out twice. If you have time, pause the video and go for more. But now we've opened up the pecs, which are pulled forward, and we've stretched out and lengthened the tissues of the front of the neck. So we're going to assess again. So I'm just going to sit here, chin up to this guy. Let's see. And then I'm going to come down, chin onto my chest. And then I'm going to look over my shoulder one direction and then the opposite direction. Ooh, that feels better. I got a little better range of motion on that side. And then last of all, we're going to do our circles, right? So I kind of did an up, back, and around to the front, and then the opposite direction, and around. And go ahead and rate yourself again. See what happened. That actually helped with my neck a little bit. So I'm more like a 1-2 than a 2-3, which is great. I hope that this is helpful to you. And if you have more specific questions, please feel free to ask me. I would be more than happy to help coach you on doing massage for yourself, especially if you have something unique going on and you need one of these techniques doesn't quite work for you because of an injury to your neck or something else. Your range of motion is different because of fusions, that sort of thing. I would be more than happy to help you figure out how to work on your own neck to relieve pain and tension. I hope you have a fabulous day and you keep working on yourself and feeling great from it. We'll talk to you another time.